Types of commonly performed cataract surgery. Manual small incision cataract surgery, MSICS. As part of this surgical procedure, cataractus lenses are manually removed. Advantages of MSICS include: 1. MSICS costs lesser than phaco emulsification. 2. The service is available even in remote areas with a basic infrastructure unit and limited technical support. 3. If the cataract is hard or if the situation is particularly difficult, it is relatively safer. Disadvantages of MSICS include: 1. Removing the lens requires a larger incision. 2. There is a comparatively higher degree of astigmatism or cylindrical power, compared to the newer techniques. 3. Post-operative visual rehabilitation takes longer. Phaco emulsification. In contrast to MSICS, phaco emulsification removes cataracts with ultrasonic energy, rather than manually. Advantages include: 1. Smaller incision. The incision made is around 1.8 to 3 mm. 2. There is a lesser degree of post-operative astigmatism or cylindrical power. 3. Eye drops can be used instead of injecting anesthesia around the eyes to numb the area during surgery. 4. Early post-op rehabilitation. Disadvantages: 1. It is a machine-dependent surgery. 2. It is more expensive than MSICS due to high technological and consumable costs. Femtosecond or robotic cataract removal surgery. This is a laser-assisted cataract surgery. This procedure requires cooperative and oriented patients, as they need to keep their eyes steady during the laser treatment. Advantages include: 1. Precise and standardized incisions and power used to break the cataracts. 2. Low margin of error. 3. Done under using numbing eye drops. 4. Can be useful in softening hard cataracts by using less phaco energy. Disadvantages: 1. It is a very expensive procedure. 2. Femtosecond laser is not available everywhere. 3. The surgery takes longer due to additional steps. No matter the type of surgical procedure, appropriate post-operative care is crucial for a successful outcome. Check out our video on post-operative do's and don'ts following cataract surgery. Subscribe for more eye-related content. Thanks.